This is the Health Behavior Theory and Behavior Change video assignment for Foundations of Health Science with Dr. Massey Stokes in spring 2021. An introduction of myself. My name is Chelsea Pettis, and I have been a dental hygienist for 10 years. I have a Bachelor's of Science degree in dental hygiene, and I'm currently working to complete my Master's in Health Studies. I chose to use the health belief model for this assignment. The health belief model suggests that if a person understands that they are in need of change and perceives the suggested changes as effective, that they are more likely to implement those changes into their daily lives. Making lifestyle changes is always challenging, so when using the health belief model, it is very important that the participant understand both the benefits as well as the barriers that may arise. The application of health belief model. The participant's name is Tara, also known as my Aunt Tebby. She is 67 years old, 5'8" and about 185 pounds, but has recently lost a significant amount of weight. So I'm unsure of her current weight. Prior to being admitted into the hospital, she was a housekeeper. I wanted to add this to give a perspective of just how active and physically capable she was less than 2.5 months ago. Prior to being hospitalized, she was put on hydrochloroquine. She was admitted into the hospital on February 5th and is currently still in the hospital. She is no longer COVID positive, but is suffering from complications, including pneumonia and substantial muscle atrophy due to prolonged bed rest. She began supplemental oxygen at 100% and is currently down to 70%. However, when physical therapy comes in, they increase her oxygen to 85%. She's not been able to walk or even stand in over 2 months. Physical therapy comes about 3 times weekly, but they are trying to get that increased. One thing that's been a problem is that her oxygen levels drop too low to continue with therapy. That's the reason that they have to increase her oxygen to 85% during therapy. Our biggest concern is that with a continuous loss of muscle and strength, when her lungs are healthy enough to maintain a healthy oxygen level, that she may not have the strength or muscle tone to even walk or stand. Bedbound and low oxygen. Tara is bedbound, meaning that she is too weak and not able to move very easily. Therefore, she is confined to a bed. This makes bathing difficult, and as of now, Tara's only been receiving sponge baths. She's also unable to physically get to the bathroom, which has resulted in using the bathroom in an adult brief or diaper. Becoming bedbound can significantly affect the patient emotionally, but in Tara's case, using the bathroom in a brief or diaper has been the most emotional part, stating that it is humiliating. As for low oxygen, if the oxygen becomes low enough, it can result in heart or brain damage. A normal oxygen level is 95% or above. When it gets below 88%, supplemental oxygen is provided through a face mask or nasal cannula. The percentage necessary is based on the patient's current oxygen level and health status. So for Tara's goals, my cousin Melissa, she is a physical therapist. Unfortunately, she lives in Louisiana, but she was able to come into town and help me. She met me at the hospital together. We worked with Tara to determine some realistic goals for her. These goals were set to be done on days that physical therapy didn't come to her room, but Melissa mentioned that if she can do them in addition to, even on the days that she has physical therapy, that would be even better and ideal for these goals. We determined that completing these bed exercises twice daily, beginning with 2 rounds of 10 reps, and resting for about 30 seconds between rounds was a good starting point. The second week, she would up the reps to 20 reps as long as her oxygen level was stable. These exercises include ankle pumps, glutes, quads, bridges, short arc quad, heel slides, straight leg raises. To the right, you'll see demonstrations of these exercises. they seem simple, but you know, when you're working with somebody who hasn't done anything like this or even stood in a long time, she was definitely struggling on some of these, but in a good way. So here are just a few more of the demonstrations of Tara's exercises: the bridge, the heel slides, and the short arc quad. Like I said, these seem very simple, but you know, because she hasn't stood or walked, or I mean, the most she's done is sit up on the side of the bed, these still are a struggle for her. Melissa explained to Tara that these exercises are extremely beneficial and important when she goes to stand, and that her glutes will be the primary muscle group that she will need. Because Melissa is a physical therapist as well as a close family member, I think Tara was more willing to do these exercises and had that cue to action, so to speak. After going through all these exercises and showing Tara how to do them correctly, we gave her an exercise log, which is pictured here, to keep on her hospital table. We provided her with a pen, happy face stickers, sad face stickers, and PT stickers to indicate whether or not she completed the exercises twice daily and what days physical therapy came to her room. Tara stated that she absolutely loved this idea, especially because it was visible for her 24/7, so it was a constant reminder that she needs to complete these exercises, and it gave her something to do. You'll notice that there's only one sad face on Tara's exercise log. She stated that she hated looking at the sad face on her table all day, and that it bothered her so much that she did not miss another exercise session. Keeping this exercise log follows Fogg's tiny habits theory that making small changes can change everything. In addition to the health belief model, we use tiny habits without realizing it until after implementing these exercises and this exercise log. This was extremely interesting to witness firsthand because I truly believe that keeping this exercise log or tiny habit is the primary reason behind Tara's success in completing these exercises. This was the YouTube video that Melissa provided Tara just in case she forgot how to do a specific exercise, or if she found that it was easier to follow along with a video rather than looking at a paper. This is more of an interactive type workout rather than just trying to read a how-to on a piece of paper. So Tara's progress. Tara missed one exercise set on day number 2. Physical therapy is very happy with her progress and sees visible improvement in her strength as well as her attitude toward her therapy. They think she may be ready to try standing one day next week. She says that she'll continue to do these exercises and even mentioned to Melissa that she wanted her to provide her with more advanced exercises as she continued to gain her strength back. She also asked for more weekly calendars and stickers. Prior to this assignment, Tara was only completing exercises when physical therapy would come in, so this health belief model assignment or project has definitely helped better her health.